Hi, this is Pat Lynch at Women's Radio. I am truly honored and excited to bring to you an expert in an area that I care a lot about, which is health and the health for all of us, and having the right things happen so we can all enjoy that health. Here's a man who has worked his entire life to bring justice and health to everyone in America, and I can't wait to bring you his story. Uh, Dr. William Bronston is a lifelong advocate for health and social justice. He has written the most amazing book called Public Hostage, Public Ransom, Ending Institutional America. You can find it almost everywhere: Audible, Barnes and Noble, El Libris, eBay, Amazon. It's easy to find, and we're also going to probably provide for you a QR code, which should take you so that you can get the book right away. This is a powerful story about changing human services in America, and this is really the essence of the story, and it had a really terrible beginning. Dr. Bronston's path to serve people with disabilities began as a USC medical student, and then he interned at Children's Hospital in Los Angeles, very famous. And following his psych residency, he worked from 1970 to 1973 at Willowbrook State School. And after a major expose in 1971 by Geraldo Rivera, it was closed by a federal class action lawsuit against the then Governor Rockefeller and the state of New York for crimes against humanity. Well, that is saying quite a bit. And later, he was the medical director for two state California departments that serve everyone with disabilities for 2.5 decades. His specialties are in pediatrics, in psychiatry, and health and public safety. I am very, very pleased to introduce Dr. William Bronston. Welcome, Dr. Bronston.
Thank you very much, Pat.
Well, we have such a lot to say in a short period of time, but as we discussed before, this should not be the last time that you're at Women's Radio, and you and many of the doctors that are trying to bring justice and health to the American people. So let's start with the book, though. So Public Hostage, Public Ransom. Why do you use those terms, hostage and ransom?
I want people to understand what we're living with, that we all accept as the norm and as okay, which is not okay and not normal. And that is that anybody who becomes dependent and somehow or another is lost to the working class gets monetized by the system as what people understand as surplus population, which means that all of the people with a diagnosis of developmental disability, mental retardation, autism, cerebral palsy, learning disabilities, and the like, essentially, in those days, this is now 40 or 50 years ago, were told by the physician community, put that kid away and have another kid. And at the time in New York, there was no community services of any kind. And so the only place for people to essentially be deposited were in warehouses, large warehouses between 200 and, in the case of Willowbrook, 6,000 beds for people with special needs. And they were funded by daily Medicaid reimbursement to the state, which meant that the state got $200 or $300 a day for everybody that was put into these warehouses. And they could decide how much or how little they spent on keeping those people alive as long as possible so that they can continue to milk the federal government for those dollars. So that despite the hundreds of dollars that came in every day, the money that was spent on dealing with or caring for those unwanted, devalued people, was absolutely shockingly little. People functioned naked, they functioned in rags, they were fed the most horrendous food, they were kept drugged because there was never enough staff in the institution in order to manage or train or essentially stimulate the people that they were caring for. So the
Well, they
longer
were just pushed away, put hidden and locked up.
that's right, in this very bucolic, 60-acre, 300-acre kind of facility with 60 buildings on it. Each building had about 200 people incarcerated there, and they were public hostages. They were put there in order to be funded by public reimbursement, which was the Medicaid dollars, which I call public ransom. The problem was that the ransom never led to the liberation or matriculation of anybody in the institution. Anybody who left the institution left feet first. They died. They died.
Right.
And
And a
so
lot of these people were young. They were teenagers. They were
they were
young
younger than
people.
that. They came in at age 4, 5, 6, and they moved through what were called the baby buildings into larger buildings. And as they became more problematic out of sheer deprivation and the butt of incredible environmental violence, they became more and more a challenge to the institution and put into darker and deeper dungeon-like facilities in the institution
Which
until
you
they
show in
died.
the pictures in the book. So you give a lot of graphic demonstrations of what went on
Yes,
there. And you
exactly.
were there for like 3 years. I don't know how you were able to bear it. I
Well,
mean, 3 years.
I identified very much with the people I was taking care of. I mean, I had been trained and raised by the top people in the world in child development at Children's Hospital, and knew all the top leaders in the world that were working in transforming mental retardation services to get away from the paradigm that these are worthless, helpless, meaningless, non-human, childlike, animal-like, people. Uh, Difference is universal. And all that we're talking about is the way in which the society handles differentness, not just disability, differentness. So the importance of the book, Pat, is that it is an alarm bell, a major alarm bell for the entire American population, because 100%
Agreed.
of all of the people in this society are going to age and become dependent in mobility, in communication, in cognition, and so forth. And
That's
they are
right.
going to be slated for institutional terminus into congregate, segregated warehouse systems called nursing homes, supported living, and the like, hospice, and so forth. And
This sounds a lot like the Hunger Games, doesn't it?
well, this is the real thing. This is the real thing. The thing that's very hard to imagine for your listeners is the gravity of deprivation, of what it means to be put into a stone room for your whole life, never go outside, have no stimulation, no training, no programming of any kind for your whole life. And all you can do is wander around in this stone room, of which there are 50 peers sitting around, screaming, throwing chairs. I mean, the level of deprivation is so mind-boggling that it's
Yeah.
just unbelievable. And I had to come in as a highly trained doctor, especially in the area of child development, into a place where I was the only physician for 200 people. Whereas I came out of Children's Hospital where there were 400 physicians for 80 people there, the top
Wow.
doctors, imaginable in every specialty. And my mentor, who was a fellow by the name of Dr. Richard Koch, who organized the regional center system in the state of New York in terms of legal policy. Anyway, the Willowbrook story is really a warning bell for the entire population that if we don't end Medicaid as we know it, if we don't end this market-based medical delivery system that
So true.
essentially is a wealth transfer insult to the general population, that
I don't think people understand
they
that
don't.
when they've accumulated, when these awful people have accumulated this wealth that they get from our tax money, that it's going into the hands of whom? Tell us.
Wall Street. I mean, it's going into the banks. I
That's
mean,
right.
Nelson Rockefeller's brother headed the largest banks and financial institutions in the country, David Rockefeller. And
That's right.
so the two brothers essentially collaborated together. Rockefeller engineered $1 billion expenditure package from the New York legislature, which they then used to build public services, whether they were mental health services or public housing or institutions. But one of the things that they built were mental retardation facilities and psychiatric facilities separately. That was a whole different administrative, kind of a mess. So we had to go after to show that once these guys engineered the financing through bond systems that were no tax bonds that the people could buy from the big banks, who essentially bid for the lowest interest rate to the state to buy the bonds to sell, that those bonds led to building these monstrosity warehouses. The problem was that there was no thought or care for how to handle the people that were put in those warehouses. They were put in there as monetized sources, as surplus population.
Well,
And
I don't think people realize that that is still going on. It's slightly
going
different.
on all over the country.
It is going on all over the country.
It's like
and
metastatic
people don't
cancer.
understand that.
Yeah. So the institution was like a large cancer. And so we were able, through federal action in 37 states, to majorly impact and start closing down all these large warehouses. But the transformation to handling aging population in congregate segregated institutions is the metastatic manifestation of that disease. And the only way to cure that disease is radical surgery. We have to end that financing system and replace it with single payer healthcare as a right in America, as a public good funded by taxes.
Dr. Ranson, a lot of people do not understand the term single payer. Why don't you, in a simple way, explain to the audience about the way things are done now and what you're suggesting that we change and how to go about that and what we can do individually? Because each one of us is at risk for this kind of treatment if we don't.
Yeah. So people essentially get their health care in large part through paying insurance premiums to roughly 1,800 different private organizations, insurance companies, the cartels. And when they use their insurance policies, they have to pay copays and deductibles if they can afford the insurance policy in the first place. And all of that is all private money. Now, 80% of all the medical dollars in the system in America are public dollars. So that were we to eliminate the role that these private financial organizations, the big pharmaceutical companies, the big insurance companies, the big hospital empires, if we eliminate that system of gigantic administrative personnel development and get rid of all those middlemen, so that people that are caregivers would bill a single trust fund at the state or national level that had 100% of every medical dollar, every health dollar in the system would be in one source. They would immediately get their financing back. People could go to any healthcare provider in the country, anywhere that was a licensed professional, get whatever they needed, go home, use a card, give the card to the provider. The provider would then build a single payer trust fund set up by law in the states or in the country. They would get reimbursed, and that would be the end of that. And there wouldn't have to be any middlemen in the system. For example, in Detroit, there's the largest hospital in that city, has 1,800 beds, and they have close to 2,000 administrators in order to manage those 1,800 beds in that one facility. In Canada, right across the border, there is a hospital of equal size that has six administrators to manage all of the billing in the Canadian system on that side of the border. Same number of beds. Between
I think people in America have a complete misunderstanding of what's actually going on right now. They have no idea who's actually getting the money. They have no idea who is pushing the what I call the poisons on the people. They don't know that they are not able to get the best procedures, the best protocols, because our government won't allow it because it would interfere with the sale of the poison.
That's right.
And excuse me, that's just the way I feel about it. But and and they don't know what they can do about it. We're feeling like we can do nothing, but we are the very ones that must do something. At this point, it's the people who must speak up. It's the
That's right.
people
We
who
have to
must take some
pass law.
action.
We
Right.
have to have propositions because the professional politicians are essentially lobby funded to not allow a change in
That's
this
right.
at the federal and at the state level. So
That's
there
right.
have to be propositions where people can directly vote at the state
So,
level. The problem is
so
that it's all the people against all the money, and that's a daunting challenge.
it,
But
it
it is
is.
essential because it essentially is the core of our democracy.
So if it's not important enough for us to demand that our candidates agree with us and say this is the most important point we have, are you going to support it or not? If we don't know and we don't ask, it's not going to happen.
That's right.
We are the ones at this point. Our health, our future, the future of our children is dependent on us coming up to speed right now. And I will promise you, we intend to do everything we can to inform the public.
If people identified with the rest of the population as family, if we
Amen.
saw each other as one people, regardless of color, regardless of race, regardless of religion, regardless of differentness, the whole relationship in society would radically change. One of the things that I proposed is I spent a year with 40 of my colleagues crafting the most imaginative and the finest healthcare delivery system on earth. And it's in a website that we've created called ourhealth.pub.public.
And we will include that link and as much other information as we can right now.
And that particular model essentially looks at the radical transformation of our relationships to one another. For example, instead of having what we now understand as long-term care, which is Medicaid funded warehousing of differentness of our surplus population, we would propose having individualized planning from early on to deflect people from ultimate segregation through a system called lifetime care instead of long-term care.
Right.
And we would have
care and health and not sickness care.
Health, that's right. We would not be focused on illness. So that would mean that the public health system in America would have to administer the overall healthcare delivery system, not the medical market system, not the financial community.
I think that's what people don't understand. So I think that's really an important point. I want us to get really, really deeply into this. I want the public to really understand what their choices are, and that the thought that has been given by you and many, many, many other brilliant minds in the medical field. And we're so grateful for you.
Listen,
so I would like to invite you to come back.
Everybody has the experience of going to a doctor and having a computer between them and the doctor, or a computer between them and whoever it is that's taking care of them. And the reason that computer is to log billing.
Amen.
For billing.
Yeah, go to a hospital. That's all they do.
Of the caregiver.
They can hardly serve the patients because their billing has to come first.
I was just in the hospital for a week with COVID. Every time somebody came into my room, and there were tons of people that came into the room, the first thing that they did with a cell phone was come and take a picture of my wristband that had the QR code to bill for them being in the room.
Right.
It's outrageous, outrageous. Now, I'm a doctor. I understand that stuff.
And what was that cost? What was that cost?
$150,000 for that week.
Right, right. And I'm sure many other people have had this experience. I hope that this small message right now is going to turn a lot of people on, and we're not going to stop here. With Dr. Bronson's help, we're going to find many, many other doctors and professionals who are going to give you information about the way things are and the way things could be, and the difference, and why that makes a difference, and what you can do about it. In fact, there is no one in America right now who can make the difference that you and I can make. But we have to be informed, and we're going to do our part by bringing you some experts to talk to this issue. So
Reading the
please
book and
stay
looking at the
tuned.
website, reading the book and looking at the website will
That's
be
right.
a powerful,
Please,
powerful
please
jump.
do get Dr. Bronson's book. I'll tell you what, one look at the cover will do it for you. But you know, he's got way, way more on the inside. So please do get this book. And I know that he's going to be all over radio and TV. I'm so happy to have had the privilege to be able to bring him to women's radio. Dr. Bronson, I really, really appreciate your being here, your time, your expertise. I hope that together we can all make a huge difference. You know, it's funny. I'm a child of the '60s, and we all thought we were going to make the difference in the universe, right? I hope that maybe this might be one small step in that direction. I really
A large step, Pat. This is a transformative public policy. This is central to the democracy, central to our democracy.
Well, I hope a lot of people hear that. I think everyone I know, I don't care what side they say they're on politically, we all believe deeply in the democracy part. So if we want to keep our democracy, there's some things that are essential, and health is one of them. Thank you so much for everything you're doing.
Thank you very much. Thank you very much.